Tell me, which young people, babies, not so babies, children, adults, or maybe adolescent, very old people or something, who is actually in general needing it the most? Or is there no such a thing? It's just kind of a percentage throughout. And what are you mainly doing? What is it you specialize? Hello, Dr. Johnson from Riverside.
Hi there, Helmut.
Doctor, you do anesthesia and basically you're putting people to sleep while they do dentistry. In your practice or in general, or different if it is different, tell me, which young people, babies, not so babies, children, adults, or maybe adolescent, very old people or something, who is actually in general needing it the most? Or is there no such a thing? It's just kind of a percentage throughout. And what are you mainly doing? What is it you specialize?
Okay,
In?
all good questions. I would imagine that the who requires it, the age group would vary from state to state, depending on their population and their population needs. I know, for example, in California, I primarily see a lot of children. And that is, one of the reasons for that is because children, especially on state sponsored type of insurance, are still have access to a lot of care as a result. Adults don't have as much, so you may not see as many getting treated. So I personally see about 95% of my practice are pediatrics or children. And then the other 5% are adults, usually middle aged, all the way up to sometimes about 70 years old. Is where and these are people who often require implants. These see these ads for these teeth in a day, and where a lot those procedures are almost always performed under general anesthesia. So I do a lot of those cases, what I call the all on four cases for the implants. But for children, again, 95% of my practice are children.
And again, just so that we didn't miss it, what is the need for children on that area? What
Well,
is
the reason is that I come across, for the most part, children who require work on almost every single tooth. And that is because of the oral hygiene habits are poor. They drink a lot of sugary drinks, end up with a lot of cavities. And there's so much work that needs to be done that it is better to do it under general anesthesia to get it all done at one time. Or there are some children who actually have some work that need to be done, but they will never sit still. And the dentist has already tried nitrous oxide, which is that sedative gas that you use sometimes. They tried all kinds of techniques and it has not worked. So generally, those are the people who I see as well who need work to be done.
okay? All right. So in your practice, in California, mostly it's children. Is that also true for when you go to Montana or to Texas?
Yes, absolutely correct. In Texas, only children I see. in in Montana, I do see some adults, again, for those big cases, or let's say some of the teenagers, I may see them for wisdom teeth extraction. So the surgeon or the dentist is doing wisdom teeth, and I do a kind of a moderate to deep sedation for those individuals. Nothing, it doesn't last more than about 15-20 minutes. They're really quick and the patient is ready to go pretty soon after that as well. I just adjust the anesthesia based on the procedure.
Mm. So, which is very obvious, we know that, but I think it, from what you said, merits to be pointed out. Your anesthesia, you obviously know the dentist says, look, we're going to need a couple hours. So you know how to prolong and you
Correct.
probably bring the person back faster if needed because you probably
Correct.
keep doing it as needed,
Correct.
right?
Correct. Correct.
Good.
Yes, you have to. Yeah, every single person does not necessarily get the anesthesia all the same way. It's tailored specifically for the person's physiology, the procedure, whatever medical condition they may or may not have. That's all taken into consideration to be able to provide an anesthetic technique that is based, it is provided specifically for that patient.
Well, I guess it has to be a little bit, so to say, complicated. Maybe it's not the right word. You may have a better word for it. That's why I guess there is such a thing like an anesthesiologist. That's why they say study 3 years so that you know what the hell you're doing, and we
Yep.
don't any other doctor do it because like
Correct.
let's take dentistry. Every dentist can do any procedure he wants to, be it prosthodontist, be it endodontist, be it periodontist. It wouldn't matter what, he can do
Right.
anything
Right.
he wants, but they don't let him do anesthesia. And so is
Correct.
other doctors. So there gotta be a reason, and that is, hey, you're putting the person under sleep, so make sure we can do this very correct.
Absolutely. And putting the person to sleep is not the hard part. The hard part is keeping them asleep and waking them up, right? You have to be skilled and trained to manage all kinds of things that can happen. And they always say, anesthesia is like 99% boredom and 1% terrifying. That is actually kind of true. So if you're not trained well, or if you're not provided for by a trained individual, then you can expect some problems. But for my colleagues and myself, of which there are hundreds and hundreds of, they're all well trained, do very well taking care of people.
Wonderful. Nice to hear. Thank you very much, Dr.
You're
Johnson.
welcome.